Hi, my name is Bonnie.
And my name is Catherine. In this video, we will describe the steps for proper oral hygiene and how this can prevent infective endocarditis, a difficult to treat heart infection.
But first, we will explain what infective endocarditis is and how poor dental cleaning introduces bacteria into the bloodstream, thereby leading to this infection. What is infective endocarditis? It is an infection of the heart chamber lining, specifically the valves. The most common cause is bacteria, but it can also be caused by a fungus. This infection can develop suddenly or over time, and symptoms might include shortness of breath or a cough that won't go away, a new or changed heart murmur, rupture in blood vessels of the eyes or under the fingernails, and there might be changes in the skin like an overall paleness, small, painful red-purple bumps under the skin on fingers and toes, or small, dark, painless flat spots on the palms of the hands and soles of the feet. But how does someone acquire infective endocarditis? This infection is relatively rare, but chances are much higher if you have a predisposing factor, like having a prosthetic or a damaged heart valve. If there is damage on a valve, the body forms little scab-like nets that filter the blood running through. Minor injury in the mouth allows bacteria to enter the bloodstream. Blood draining from the lower jaw has a pathway that leads bacteria straight to the heart. The nets on the damaged valves catch the bacteria, which begin to grow. This is called a vegetation. Vegetations prevent heart valves from pumping blood effectively to the body. Without proper blood flow, organs are unable to function and begin to fail, which can lead to death. In patients with high risk, antibiotics can be given before a procedure to help prevent infection. However, treatment can be fairly difficult once an infection is established. Since blood does not directly supply the valves of the heart, antibiotics have difficulty reaching the vegetations. It is important to start treatment as quickly as possible, as this infection can lead to death in as little as 6 weeks. Prevention is the best cure.
The likelihood of developing gum disease increases with smoking, diabetes, sugary diet including gum, acidic foods and drinks like soda, hormonal changes in females, medications that reduce saliva production, as saliva contains antibacterial properties. Some of these can be prevented and some can't, but change what you can to reduce your risk of gum disease. How is bacteria introduced into the bloodstream? A film of bacteria on the teeth releases toxins into the gum tissue, causing them to become red, swollen, and bleed easily. This is called gingivitis. The bacteria on or in between your teeth must be removed every day to prevent gingivitis. Poor oral health leads to gingivitis, which also leads to periodontitis, and eventually tooth extraction, which carries its own risks. Most people think a dental procedure like a root canal is the only way to introduce bacteria into your bloodstream. However, brushing your teeth introduces far more bacteria into the bloodstream because there is so much more bacteria above the gum line than below. The bacteria enter the bloodstream through the bleeding gums, then travel anywhere in the body, including the heart, especially since, like Bonnie said, it has almost direct access from the mouth. Practice these good oral hygiene steps to prevent or reverse gingivitis. Brush your teeth with a soft bristled toothbrush, manual or electric. Use a fluoride toothpaste approved by the American Dental Association. Hold toothbrush at a 45-degree angle towards your gums and don't brush too hard. You shouldn't be flattening out the bristles. Brush for 2 minutes total, 30 seconds for each quadrant of your mouth, and don't forget to brush your tongue. Also, definitely brush twice a day. Floss teeth either before or after brushing, once a day. Floss in between all teeth, especially up the sides of each tooth where the toothbrush can't reach. Rinse with mouthwash after brushing and flossing or in between brushing to refresh your mouth. Use a mouthwash with fluoride and no alcohol. And finally, visit the dentist at least once a year for a checkup.
In conclusion, the easiest way to prevent infective endocarditis is by practicing good oral hygiene every day.
Thanks for listening and happy brushing.
Bye.